Welcome to Clinical Trials Facts Wednesdays. And this is Tengumuna with Achaibo Clinical. I am very delighted that you have joined us at Achaibo Clinical. We're passionate about two things: clinical trials and success mindset. This month, we are going over the operations at a clinical research site. And the first thing I want to talk about is the personnel at a clinical research site, because as you guys know, the team always wins. We have to work with other people. We have to engage for a common cause and a common mission. So the first person that I will discuss is the principal investigator at the clinical research site. This is the oversight person. I also call them the key opinion leader. They are the strategist, and many times they are also an entrepreneur. So the goal of the principal investigator is to really provide clinical oversight for the patients who are in the clinical trial. And that's why we absolutely need a clinician so that they can be able to make decisions about that affect the safety of the patient. Now, the second group is the sub-I. This is the backup, or the one who assists the principal investigator. And it also depends on the country, but the expectation is that it's also a clinician. So that way, if something should arise and the principal investigator is not there, then they can provide an informed decision as to the well-being or the welfare of the patient who is participating. The clinical research coordinator is the next role. I would say they are the heart of clinical trials. They are the operations person. Many times they're doing, seeing patients, capturing the data. I mean, they're really the ones running the clinical trials at the clinical research site. And the principal investigator maintains oversight, right? So this is one of the responsibilities that the principal investigator delegates, because PIs and many times sub-Is, clinicians, they are seeing patients. They might be running a clinical trial, their clinic, and they're still seeing patients. So you really need someone who has the experience or the operational experience to be able to manage the output from what is happening at your clinical research site. And then other roles could be a lab technician if they're sample draws or biomarkers on the project. We might have raters as well. Sometimes we do use questionnaires. And of course, it's based on the therapeutic area. So clinical trials mimic actually what is going on in the real world and the standard of care. We might have a data entry person. We might have someone who's a recruiter, someone who helps to do community outreach to ensure that patients are actually being recruited, someone who is reviewing the clinical charts. And the interesting part is that in most cases, the clinical research coordinator does all these roles. We might have a regulatory person who is managing essential documents, again, also assigned many times to the clinical research coordinator. So the big takeaway here is that even at the level of the clinical research side, there are so many roles and there's so many opportunities. But of course, it starts with the principal investigator understanding what exactly they're delegating and how to best manage that. So that's our short talk for the beginning of the month. It's going to be a really good series coming up in March. Make sure to join the WhatsApp group. We have free resources on our Facebook group as well, and the YouTube playlist. We have our free webinar, sign up for those. And of course, if you're interested in our clinical research training programs, you can send me a message. If you're on the WhatsApp group, you can ping me privately, and I will be glad to assist you. Remember, be passionate, be full of integrity, and always rise to higher levels of excellence and success in your life. And I will see you next week. And thank you for listening.